Hey there, what's going on? It's Dr. Mike T. Nelson here, and I'm actually recording this little intro from a hotel just outside of Spokane, Washington. I'm getting in my car, the rented vehicle here, and driving out to the mountains of Idaho in just a couple hours to help out with the Special Forces experience. I'm one of their helpers there with the process, which is an 8-day high stress event for all the candidates coming in. They spend about 9 months preparing for it. And the goal is to stress them out in a very intelligent and progressive manner to facilitate post-traumatic growth. And I'll have a full update probably later once I get back. But the reason I wanted to get this audio intro out to you is I did an amazing podcast coming up here with Dr. Ryan Greene and my good buddy, Dr. Andy Galpin. Andy was on a very, very early podcast quite some time ago now. And I heard Dr. Ryan Greene on the Great Barbell Shrugged show, which I've been on a few times. Shout out to my good buddies there, Doug and Anders. If you haven't checked out their show, highly recommend it. And it was great. I've sort of at a periphery followed some stuff in the peptide space, but I haven't taken any real deep dive into it at all. I was kind of unimpressed by most of the information and the so-called experts I saw online. But once I heard the episode, I reached out to Andy and said, hey, if you and Dr. Ryan Greene want to ever do a super deep dive into peptides, let me know. You have an open invite to come on the show whenever you want. And both of them said yes, they would love to do that. So I'm super stoked to have them here. And if you have no idea what a peptide is, or a hormone, or SARM, or anything of these weird technical terms, that's okay. We had Dr. Ryan break down the difference between them. Kind of what are peptides, which are these kind of small molecules you can potentially use for health, longevity, maybe some muscle gain, faster recovery. We go into all of the pros and the cons of it. What do you need to do beforehand? Newsflash, peptides won't solve all your issues, but in some cases they can be very effective. We also talked about who can use them. Are they regulated? What is the status of that? How does this fall in terms of drug-tested athletes? And much more. So enjoy this episode of the Flex Diet podcast. And this one is brought to you by Physiologic Flexibility. So one of the things I did with the PhysFlex cert, which actually, by the time you're listening to this, just closed yesterday, but you can still get on the wait list for next time, is setting up ways to precondition or apply a small amount of stress to your body. And this will hopefully add more robustness to you and increase your chance of post-traumatic growth instead of maybe PTSD or other negative things when you encounter a future high stressor event. So I'll have more experience with that coming up very soon afterwards. But you can go to physiologicflexibility.com for all of the information there. Any questions, you can drop me an email. I will get back to them as soon as I am back in communication into the land of the internet again. So enjoy this podcast here with Dr. Ryan Greene and Dr. Andy Galpin, all about the world of peptides. Hey, welcome back to the Flex Diet podcast. I'm your host, Dr. Mike T. Nelson. And today we've got two special people on the program. We've got Dr. Ryan Greene, and we've also got good buddy, Dr. Andy Galpin. And today we're going to be talking all about peptides. And if you don't know what peptides are, then perfect. If you kind of do know what they are, I think you'll probably learn some new stuff in this episode. So Dr. Ryan, do you want to start it off with just a little bit of your background and kind of how you ended up doing peptide stuff?
Yeah. So originally trained in the ortho sports space, thinking surgery was going to be my future, working with athletes. quickly appreciated my time and effort in the hospital system would be working with people that missed many opportunities to find, optimal health and avoid surgery, and looking at what my quality of life would be like and the ability I would have to impact patients for a long period of time. I decided my road needed to move more towards the preventive space. And so I took a detour at the Mayo Clinic for a fellowship looking at clinical research and contributing to that sector. And I enjoyed it, but I realized, not working with patients was something that was not what I wanted to make my practice long-term. So did an extra fellowship in what's called integrative medicine through the University of Arizona with Dr. Andrew Weil. Nice. And kind of rounded out my scope from the complementary alternative nutrition and preventive space. And in that period of time, I came up with the idea with some partners for what is now my startup in Los Angeles called Monarch Athletic Club, which is a one-stop shop, comprehensive wellness offering. So every member gets preventive medicine, nutrition, physical therapy, and strength and conditioning to create a lifestyle modification program that can be tracked in real time, modified, and is ultimately significantly less costly than if you tried to do all those things independently, and can also leverage the traditional insurance system. So I'm taking a little bit of everything that I learned and I just pulled it all into one spot so we can create an opportunity for people to literally just show up. And as long as they do that, they should achieve reasonable health promotion. And during that period of time, just working with my cohort of people in Los Angeles, anti-aging longevity is a huge topic of conversation, and people kept talking about peptides, growth hormone optimization. So I started to look into it a little bit further, and I tried to introduce things that help the body do what it's already doing versus supplementing or replacing. And that's where peptides became a large area of emphasis for me, just because we're using what the body already produces and supplying it when needed to help just kind of optimize our physiologic function versus introducing things that are kind of masking some of our less efficient health behavior. So that's what brought me to this space. And, I'm happy to discuss and teach and educate more about it.
Awesome. Thank you. And tell you a little bit about yourself there, Dr. Andy Galpin from California.
Well, I think I've been on this program before.
Yes, you have. That's right.
Yeah, a few times. So I'm a full professor and scientist at Cal State Fullerton in the areas of human performance, and I've been out here for a decade or so. So I run the center, and we perform research in any area that we feel like could potentially aid in human performance. So this is classic exercise physiology stuff to even some slightly cuckoo stuff like breathing. We thought was cuckoo at the time, but that's not so much cuckoo.
You mean it's essential and important? What are you talking about? How crazy is that?
Turns out. To a lot of different areas. And then I also work directly with a lot of professional athletes across a lot of sports in a combination of roles, everything from strength and conditioning coach to kind of director of high performance consultant sort of thing to nutrition, blood analysis, interpretation, kind of et cetera, all over the place. So I'd say a number of years back, I don't know how many years back, Ryan and I crossed paths through a very good mutual friend. I can't remember that dirtbag's name, so I'll just leave it out. But anyways.
It's not important.
Not important.
Not important.
Who was part of helping Ryan get going with his stuff. And so basically Gabe said, you got to meet this guy. And anything Gabe says I tend to think is complete garbage. But I reluctantly met Ryan and found out actually Gabe wasn't totally wrong about this one. So I've been fortunate enough to work with Ryan together with athletes in a few different scenarios. And so, recently I was like, man, telling some colleagues of mine, like, you got to get this guy on your podcast. He's doing some really good stuff. And he's a really smart guy. And so we did that. And then you listen to that podcast, Mike, and you hit me up and you're like, you got to get him on here. I said, all right, we'll do that. So that's kind of a little bit of the background of me, as well as why we're both on your show today.
Excellent. Yeah. And if people want a little bit more background, they can listen to the Barbell Shrugged episode that Dr. Ryan was on. That's originally where I heard about him and was like, wow, this is cool, because I'm pretty much a walking idiot in terms of peptides. I don't know much of anything. So this is perfect to answer some questions. And it's anything I think that's kind of on, quote, the bleeding edge is always interesting. But at the same time, you're always trying to balance, like, what data do we have? Is it efficacious versus, what is all the hype and everything around it? Because everyone's always looking for the next shiny new object. And a lot of times there isn't anything really new, but sometimes there is stuff that does actually work. So you can't really just throw it all out and go, oh, it's all garbage. It's like, no, there's some stuff that actually works. It's how do you kind of sift through all of it to figure out what is potentially efficacious and what of it is just bunk and trash and don't waste your time on. Hence this podcast. So Dr. Ryan, how would you describe for people listening, like, what is a peptide? And the follow-up question is kind of the difference between a hormone, a SARM, and a peptide. Because I think a lot of people kind of mix those three terms up and use them, unfortunately, interchangeably, and they're kind of all different categories.
Different. Yeah. So peptides, to answer your first question, we've been using them for a long time, 50, 60 years. Insulin's a peptide. Dr. Galpin heard me talk about this before. We've used this science for a long period of time, but it was for more, acute, life-threatening health conditions such as diabetes. Since then, the discovery of more peptides specifically for human performance, longevity, anti-aging, inflammation, tissue recovery have been discovered, synthesized, and intermittently have become available for use and now more regularly in the US. Peptides, for the most part, are secretagogues, meaning they're being introduced to stimulate the body to produce something that will allow us to heal tissue, reduce inflammation, recover from, movement, things like that. Basically help us build resilience against stress and things that can contribute to the aging process. So some peptides can be hormones, but most are like prohormones. They're stimulating the body to produce a hormone, which is different than if someone was prescribed HGH, which is very common in LA, which is a synthetic, non-bioidentical compound that is similar enough to bind to and contribute to growth, but it's not, with it not being bioidentical. Essentially, if you're taking it to help with muscle recovery or weight loss, if for whatever reason you have heart inflammation or you have some sort of tumor growth somewhere that you may not even know is present, the body's going to take that compound and use it wherever it needs to be used. You don't get to direct where it's going to go. And that's where the potential risk for adverse effect, which is commonly seen with growth hormone, can be problematic. The other thing that peptides traditionally are different than in terms of hormones is there's really no negative feedback loop. So for instance, testosterone is the most commonly prescribed hormone. If you're taking it, the body knows that you're getting testosterone, so it decreases its own natural production, which if you need testosterone or you're not producing it, you have Kalman syndrome, something like that, then it's reasonable to continue to take for the rest of your life. If you're just using it for anti-aging, longevity, potentially some sort of tissue healing issue, typically you can't stay on, or you shouldn't stay on testosterone for a long period of time, which then requires, when you're completed with your course, you need to essentially reinitiate your own physiologic mechanisms to start producing your testosterone again. And a lot of people don't know that. They're not monitored well, or they're going to clinics that are not overseeing their patients as well as they probably should. So people get meds, they take them, and then they just stop and they wonder why they feel like garbage, especially when they're not on the hormone. Well, it's because you basically told your body for the last 3, 6, or however long, you don't need to do this anymore. So your machinery, the factory, shut down, and it takes a while to re-engage those components if they come back at all. And usually they will, but sometimes it may take a long time. So peptides, bioidentical, stimulate the body to do certain things that will help with recovery or a multitude of positive physiologic outcomes. If they're not going to be used because they're made up of strings of amino acids, the body can break them down and use them for other things. So the potential adverse effect and risk profile is significantly lower than if you were to use a synthetic, growth hormone or something like that. And again, there's no negative feedback inhibition for the most part. with many of these peptides. In terms of SARMs, those are essentially just molecules that bind to receptors that either are agonists or antagonists, basically making something happen or not happen, depending on what you're trying to achieve, whether it's, stimulating muscle recovery or, stimulating a testosterone effect or preventing the breakdown of testosterone, whatever that's doing. So they're all similar, but there is a difference in terms of all three. And I think peptides, in terms of longevity, safety, efficacy, I like to think that they are one of the healthier things that you can introduce to help optimize human performance with a fairly low risk. And also from a cost standpoint, they tend to be significantly less in terms of overall cost. Very rarely or anything in those realms that we talked about, hormones, peptides, or SARMs, are they covered by insurance? So the other thing people have to think about is, like, if you're going to do this, are you going to be able to do it effectively for the treatment course that's required? And are you going to be able to afford it, which sometimes people can't. And then they, it's like, doing half of a treatment protocol, which isn't going to elicit the outcome you want and may actually introduce a little bit of risk. So that's kind of peptides from a macro level, and their difference between those other components you mentioned.
And they've been around for quite a while, but is one of the reasons we haven't heard a lot about them because, from my understanding, is that they're not necessarily patentable pharmaceutical compounds. So they exist in sort of this limbo land of, it might be efficacious. Who's going to pay for the research to look at it? Because if I'm a big pharmaceutical company, I can't patent it. So there's not a lot of incentive to run a whole bunch of trials on it, because at the end of the day, we all know someone's got to pay for that. And if they're paying for it, unless it's just NIH funding or something else, then they want a return on their investment then.
Yeah, that's exactly correct. So it's essentially like something that goes straight generic, and from the pharmaceutical standpoint, and the goal of a pharmaceutical company is to make as much money as you can while you have the patent on it for its proprietary value, and then inevitably it's going to go generic. So because it's bioidentical, because it's something your body already produces, it cannot be patented. Thus, the research, at least in the US, to demonstrate efficacy as rigorous as we would do with randomized controlled trials for other medications or phase 1, 2, or 3 studies. I don't know if they'll ever be done, maybe someday, but for the most part, we're essentially amalgamating case reports, retrospective analyses, things like that smaller entities are doing independently. And then may do meta-analyses here and there to pull as many studies as we can together and try to make a determination of, are these things efficacious or not? And for the most part, we're seeing a shift at least in the medical side, with plastic surgeons, orthopedic surgeons who are acknowledging their efficacy. And some independent practitioners are starting to recommend utilization of peptides post-operatively because they're seeing benefit in terms of tissue healing, recovery time, recovery efficacy. Their outcomes are getting better. People are able to return to a similar level of performance as pre-injury, versus in many cases, you may only get 80 or 90% back to where you were after an injury and a surgical intervention. So it's one of those things where it's going to be a little bit of a grassroots campaign to get people to better understand what we're doing. But literature and, academic and clinical study is going to be necessary, and it's just going to be smaller in size and scope. But, with the work of you and Dr. Galpin trying to increase awareness, I think people will then have the opportunity to evaluate, or at least, seek some sort of clinical guidance in terms of, could this help me? And the next part from my end is educating other practitioners in terms of what should be used, when should it be used, why should it be used, and then how can it be used effectively. So it's not going to be as robust a rollout as Viagra, because we don't have the funding that those entities do, but we're moving in the right direction.
So I'm not going to see peptides being advertised during the next NFL season.
Definitely not in pro sports, but it's a good point, because we're seeing this movement in social media where essentially, like, it's not illegal to seek teleconsult. And if someone says, hey, CJC ipamorelin would be great for recovery for you, like, you may never meet a practitioner, but all of a sudden it ends up at your doorstep. are you doing it appropriately? Are you doing it for long enough? Is anyone following you and guiding you to make sure like it's working? Probably not. And they don't have to. And we're seeing that in erectile dysfunction. We're seeing that in hormone therapy. And it's a little bit off-putting because I think we're creating a narrative for a lot of people that these things may not be as effective as they could be because they're not set up for success. They're just like, oh, I have low energy. I think I might need testosterone. And then I got this online prescription and it showed up at my door. So like, that's where it could go. I hope it doesn't. But I mean, it's not impossible. So hopefully we can generate more awareness, education, and understanding before, some businesses recognize the opportunity for profitability.
Nice. 2 more questions, and I have some stuff for Dr. Andy. Yeah. Because of that, so you're saying that my fear is that people will try to, especially in the fitness realm, sort of self-medicate themselves and go like, oh, look at this website. I'm going to order blah, 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 and it'll just be shipped to my door.
Exactly.
Because I highly doubt they have the training to know, one, what protocol to do. And my limited understanding is that there's probably a lot of shady companies that are trying to make money off of peptides. And if you're not really being followed by a physician, they haven't checked the background of manufacturing, etc.
Correct.
How would you know? Like, you don't have the equipment in your home to test it.
You do not. And I think that's the knock on the peptide space to date. And Dr. Galpin can either confirm or deny, but like, it seems like peptide pharmacies are shut down every day in terms of they used to be able to produce something. Yeah.
Confirmed.
And then randomly their website's gone and you're like, all right, well, what happened? Why did it get shut down? And, should I actually be using the stuff that I got from them? So it's becoming a little bit more complicated, but there are, validated, certified places that are producing high quality products. You just need to find them and find who works with them, because technically you can order these things over the internet, but what I would do is work with a practitioner that's been trained in, peptide therapy and cellular medicine. So, that's where we have to do some work in terms of building that network and allowing people to gain access to people, for a reasonable cost. Because the other thing too is, anti-aging longevity, like the cost associated with these things is astronomical. And it doesn't need to be. Like, the cost of peptides is, for all things considered, relatively reasonable, a couple $100s a month for the most part. And you're seeing people paying multiple $1,000s a month. And I don't know why, other than, added costs for who knows what. So.
And in terms of the FDA, it seems like the FDA has kind of looked at them as, again, this sort of gray area. And does the FDA sort of frown on peptides, or because I know there's sites that say it's a research chemical, it's for your lab rats at home, and then you've got legit sources that are through a physician, and kind of seems a little bit more wild westy to me.
Yeah, it's mixed. So there's about 60-ish FDA approved peptides for introduction into the human system. There are plenty that are not technically FDA approved, but you can get from third-party sources that are technically designed for laboratory or research use. So you have to be careful where you're ordering, who you're ordering from. You have to ask and inquire with your physician, like, where are you sourcing this from? Because they may be pulling from a third-party source. And then, again, it seems like every month, different states, boards of pharmacy, medical boards are either allowing things to be used, or then all of a sudden they're prohibited to be sent into the state. You don't really know what, why, or the rationale behind those decisions, but it is a little bit of a moving target. So we are not in a space where I would be confident that anything is going to be available for any period of time, but there's a handful that are pretty well documented in terms of their efficacy. And for the most part, I don't think anything's going to change in terms of access to them, such as CJC, Ipamorelin, BPC 157, a couple things like that. So, we're still very, very early in the space, but a lot of exciting stuff to come from it.
Awesome. Any comments on that, Dr. Andy?
No.
A question for you is that
I just want to reiterate that if we're going to get to a lot of the stuff details here in a second, but if you go down this route, friends at home, just please don't do it until you get it through somebody like Ryan.
Yes.
That's the only thing I'm going to say. Like, you really, really, and if you're paying $26 for the month's supply or something, you better know what you're getting, and it's not what you think you're getting. So just please do whatever it takes to find someone who's qualified. Just work with Ryan if you want to, but go that route if you're going to go to peptides. You're not playing games here. There can be serious consequences on this stuff. If you take it normally, it's actually super safe generally. Most peptides are very, very, very safe, as Ryan talked about earlier. But buying things on the internet from, who knows where. Well, better expect you're playing with hormones and hormone-like things.
Yeah.
In this case, peptides, but still, they work.
Yeah, I always get nervous when I see companies, and this has happened in the supplement world too, like pop up, try to sell something that's super sexy, and then they just all of a sudden disappear again, and then another company pops up and disappears. I always think, I'm like, okay, so what is the incentive for said company to go through all the hoops to make sure it's legit, to make sure if it's an injectable, it's sterile? Like, that costs money, right? So if you're doing it legit and you've got a brand name and people are associated with it, you've got something to actually lose if you screw up. If you're a brand new company that just pops up, you don't really have a lot to lose. And it just makes me nervous. Like you guys were saying, when you see companies show up, they disappear. God knows what's in that vial. You're not going to be able to test it. And, a lot of them are injectable. So if it's not sterile, you're going to run into those issues. Plus, what other contaminants did they put in it? Like, maybe you get lucky and it's just sterile water and it doesn't do anything, but it could have God knows what in it. So yeah, I agree 100%.
Yeah.
And Andy, are these, go ahead.
Yeah. I was going to say, like, same thing with the nutraceutical space, like the threshold for any company to participate is it GRAS, generally regarded as safe for human consumption. And as long as they pass that, minimum required barrier, like, who knows what's in it. So, I like to believe in the best of humanity in the sense that, like, companies aren't going to send out cyanide, right? But, you may be getting, like you said, sterile water, and like, great, you've spent a couple $100 a month for nothing. So most people don't have a mass spec to test their products. So,
yeah, and that might be even on the nice side, right? You could have heavy metals in it. You could have contaminants. It may not be sterile. It's like, who knows?
Who knows?
Yeah, I agree. Yeah. And Andy, are these, if someone is a professional tested athlete, I'm assuming these are on the banned list of compounds, correct?
No, they aren't. So this is where, like,
they are not. Okay.
That
I get lost if they are or not all the time. So that's why I'm asking.
Well, it's because it's a moving target. This target moved on us a couple months ago. It depends on also what professional organization. So the PGA Tour, other folks that are under USADA or WADA, it's a different thing than Major League Baseball CBA, NBA CBA, NFL's CBA, and then the UFC, etc. So number one answer is it highly depends on the sport and their testing battery. NCAA, I don't think, has really any legitimate testing for most of this stuff, which is, I guess, my subtle way of saying take whatever you want, you won't get caught. Just kidding. Don't do that. Kidding. Right. And then it depends on each individual one. So actually, that's one of the first things I was going to ask, Ryan. I know that PPC 157 was just put on the list for USADA and WADA. But do you happen to know offhand some of the more effective ones that are generally legal? We'll start there, or maybe whichever way you want to start. Generally, like illegal.
Yeah. So unfortunately, I'll start with the illegal. So anything that's a growth hormone secretagogue, so anything with the suffix morellin, ipamorelin, sermorelin, those are all out. BPC
CJC is going to be the same boat, right?
Yep. So CJC. So those are the common ones that, those are probably the most well-known, most efficacious, and commonly used. And those, unfortunately, if you're WADA, USADA, whatever testing agency, those are out. BPC 157, unfortunately, just fell under that realm, which is unfortunate because, again, like, most people are using it for, injury healing. And instead of anti-inflammatories, opiates, things like that. Like, this is far more safe and
but they can still get a cortisone shot.
You can still get a cortisone shot, and you can still take opiates, and you can still,
Right.
I mean, they're still doing Toradol,
Toradol, you could light them up on Toradol all day.
Yeah, going out of style. And that's Toradol is 100% illegal in most professional sports, but it's still happening all the time. It's just they're not testing for, anti-inflammatory utilization. So unfortunately, the ones that are most efficacious, the Morellins, BPC, out. Some of the newer ones, Apidolon, thymosin alpha beta, GHK, CU, which is like a copper supplement used for tissue healing, hair regrowth. Those are still technically legal because I just think they haven't gotten to the point to make them banned in sports. So some of the newer ones that help with, potentially energy, cognitive function, inflammation, other than BPC 157, you're probably still okay based on my most recent research. But the ones that are most commonly known these days are unfortunately not available for use legally.
For athletes.
For athletes.
On that note, then, for the non-athlete, maybe I'm assuming people that listen to Mike's program are athletes, but not pro athletes. So they're, like they train hard, they work out, they compete maybe, but they're not pros. So are there ones that you'd say, like, again, are generally safe and generally not going to ruin your entire endocrine system, but are generally effective for performance enhancement for non-performance athletes?
Yeah, I think the two that I used most frequently are CJC ipamorelin. So CJC 1295 ipamorelin is great for tissue repair, muscle recovery, body composition improvement, helps with sleep, which is, usually a huge issue for a lot of people, getting good quality sleep. BPC 157 was initially isolated in gastric juice, and it was identified as something that can help with intestinal epithelial repair. So basically individuals with irritable bowel, inflammatory bowel issues. It can be administered orally to help fortify the body's ability to repair inflammatory related issues of the gut. But systemically used, it's been wonderful for tissue healing, specifically ligament and tendon. So areas that are notoriously poor for blood flow and healing time. I've actually started with my patients who are doing BPC. The traditional guidance is just, inject in belly fat and let it go where it needs to go. But I've actually found a little bit more of a localized administration. So if you have rotator cuff tendinopathy, you're injecting in the delt. If you have a knee issue, we're going in quad. So a little bit more localized administration, I've actually found is a little bit more efficacious in terms of healing. But that's great for individuals that are dealing with chronic inflammatory issues, especially of musculoskeletal tissue. An interesting one now that's, I don't think it was as relevant as when we were on Barbell Shrugged, but semaglutide. So I don't know if you guys have been following that, but
no, what is that?
Okay, so semaglutide is
this is legit, actually. Like, this is a real legitimate, like, fucking super exciting thing.
Yeah. So semaglutide is a molecule that helps with weight loss, essentially, and the FDA approved a couple different things, but the notable one was in June of 2021. Wegovy, which is the brand name of semaglutide, essentially is a GLP-1 agonist that helps with regulating appetite and food intake. And so basically the study showed that if you're taking this GLP-1 agonist in addition to monitored diet and exercise, people are losing a significant amount of body fat and keeping it off for a long period of time. My question with the data is, these people that were doing it also exercised and ate a little bit better. So, like, is there a confounding factor of just like better lifestyle optimization? Probably. But semaglutide alone now is available with many peptide pharmacies, and the Wegovy, which is the brand name, is roughly $1,300 a month, and you need to do it for 12 months. a 3-month course of semaglutide from a reputable peptide pharmacy is around $400 a month. So it's almost, 20% the cost of what you would be getting if you had it prescribed and got the brand name. So that's pretty exciting, because when used appropriately, which is once per week, again, for a 3-month course, and then if you need to cycle it, multiple times, you can. It is pretty effective when paired with diet and exercise modification. So that's one I'm starting to use a little bit more, because it's very helpful with weight loss.
That's a New England Journal of Medicine stuff too. So that's not in clinical obesity journal club stuff. Like
that's the GLP. I have a lot of patients that are medical professionals that are docs that are just like, they're critical care attendings. They're like, I work 24 hours on, 24 hours off. I never sleep. I'm having a hard time maintaining body weight. So they're starting to look into this, because, it's helping amplify the results that they're appreciating from the, limited exercise and dietary modification that they can sustain based on the stress of their job. So that's pretty cool. And then the other one is MOTS-C, MOTS-C, which is similar to a growth hormone-like substance. Essentially, it's improving insulin sensitivity to help with blood sugar metabolism, lipolysis, and fat utilization for energy. And that's usually paired with B12, which people have been using B12 for energy and weight loss forever. So it's essentially amplifying the synergistic effect of B12. So those are like the 4 right now that I'm using pretty regularly. I do have some patients that are using thymosin alpha and thymosin beta. And without getting too far into the weeds, so your thymic gland.
You can go in the weeds. That's why Andy's here. He's going to ask you all sorts of weedy questions.
So your thymus is essentially an organ that dissolves or becomes inactive roughly around the time that you complete puberty. And its purpose is to essentially produce immune cells to grow them and then release them into the body. But once you're an adult, your immune system, for the most part, is fairly competent. We have found over time, though, with the amount of inflammation and general lack of health that we're experiencing as a population, we start to have immune cells that are less than functional, may become, problematic in terms of leukemia, lymphoma, and things like that. And so essentially what you can do is stimulate the initiation of thymic activity through thymosin alpha and thymosin beta. And individuals who have chronic inflammatory issues, gut issues, things like that, tend to see a resolution in a lot of those inflammatory issues, because basically what their body's doing is like, sending in new soldiers that are better, higher performing, and more effective than the current population that we have. So I have a lot of people with like Crohn's, ulcerative colitis. Those are, they see some impact, but inflammatory bowel issues seem to be prodigious amongst especially high performing individuals, because there's a direct link between stress systemically and gut health. So those things can be effective too. So there's probably about 6 that I use pretty regularly.
So the gland doesn't completely disappear then, right? It can still be stimulated with the peptide to kind of work again for oversimplistic view.
Yeah. And so, some people, it may not, reinitiate its production, but for some people it does.
Very cool. Yeah. And the GLP-1 agonist you were saying, is the peptide version, is that literally the same as a pharmaceutical version, or is it just doing the same thing?
Same exact thing. Literally.
So it's exactly the same.
Exactly the same.
Huh. Interesting.
Yeah. Exactly the same.
Yeah. If you want to pull up some numbers on that, because I think this is actually relative. I pulled up that paper in the background. I'll put it this way. Like we're all on the same page here. I suppose we should have started it in terms of lifestyle is king. Whole food, nutritional factors, like these are everything, right? Like these are real systemic changes. All that stuff true. And all of us are as anti, diet in a pill as you could possibly imagine, right? This is the first thing I've seen where you're like, oh shit, like we may have stumbled upon something that actually might work. Mm-hmm. And I have all the same concerns that Ryan has. Like we need replication, we need stuff. But there's a reason why a lot of people that I know in this space have started using it with their general weight loss population, especially the really obese ones. Like the power. So here's basically like some numbers, again, from this single study. two groups, lifestyle, same. One got placebo, one got the treatment, right? You're talking 2,000 people in the study, something like that. And they did 68 weeks. So there's not like a 6-week trial, right? Like a decent one. So they said, all right, how many participants lost 5%, had a 5% weight reduction or more, right? In the treatment group, about 1,000 patients. In the non-treatment group, about 200. So about a 5x increase in the amount who just lost 5% of body mass. The amount who lost 10%, about 800 versus 80. So you're talking like a 10x, and then the other one, 15% or more, 600 people versus 28. And so like in terms of the absolute amount of weight lost, you're talking about 15 kilos versus 2 between the groups.
Yeah.
So
yeah, it's significant.
Yeah.
That's very significant.
You can see why people got so ultra excited about this, because it is something that, and Ryan, maybe actually, I don't remember what the dosage is, but it's a weekly shot.
It's a weekly shot. So the typical recommendation is like 12 and a half units the first week, weeks 1 through 4. Then it like bumps up to 25 units. Then it bumps up to 50 units. The only downside, I've had some people got a little aggressive and bumped up their dosage because they were excited a little too quickly, and it can cause a little bit of a diarrhea. Some people get hypoglycemic. So it's not, completely devoid of potential adverse effect, but it is effective. And, again, like in terms of people that are, definitely, like as Dr. Galpin said, like my takeaway from the study is, yes, it's effective, but it was also effective because people were actually changing lifestyle for a year. Like, I don't know how many patients you guys work with that can commit to anything for a year. And it's not a lot. Most people don't even stay in a job for a year. So that's where the work needs to be better described and explained to patients in terms of like, this will work, but it works if you do these other things, and you cannot cut corners. And that's, I think, an analogy I was thinking of before we jumped on here is like, think of it like golf, right? If you suck at golf and your swing is terrible, it doesn't matter if you have the best technology, you're not going to hit the ball any further or any straighter. And that's how we have to think about like peptides. Like if you're not doing the base groundwork, these things are not going to contribute to the efficacy and impact that you're looking for. Like you have to have the foundational elements dialed in order for these things to be as effective as they can be. And that's the conversation I unfortunately have to have with a lot of people, which is like, just because you have money and you can pay for it doesn't mean it's going to cure all your ills. So that's the other thing about peptides is like, they are super effective when used appropriately in an environment that's conducive to, your intended result, which typically includes some lifestyle modification as well. Yeah.
I don't ever see myself asking someone to go on or looking for someone to prescribe anyone I work with semaglutide. Like this is never going to happen, right? For the general population, this is much more like in line with what they're after. But just in case people are interested, I don't even have a clue. Do you have a rough idea of what like a month, or say like a 5 or 6 month or whatever? What would that cost someone?
Like a vial right now, which is a 3-month supply, is roughly like $400.
Okay, so that's super cheap.
That's not bad at all.
No, it's not bad.
Some of the peptides we'll talk about maybe are that per week.
Yeah. It's a little bit more expensive, but yeah, for the most part, I mean, if you're going to do the brand name, I know it's $1,200 to $1,300 plus, and insurance usually is not covering it. So it's a significantly greater expense. It's almost 10x the cost, all things considered.
I actually see this as being one, like, I think insurance is going to jump on this one pretty quickly.
Yeah. You would think they would, right?
We'll see.
Yeah, you would think. Yeah, that's a conversation for a different podcast and why that may not happen, but yeah.
All right, fair. Okay, so maybe when we're here, is there any other ones for general health? For like or we can just skip this part, Mike, if you like, when people don't want to hear about this.
No,
shit.
It's good. Go for it.
Yeah, any other general ones, like for the average person, okay, they're going to commit, they're going to work with you, they're going to work out a couple times a week, they're going to eat better, but you want to just like give them some shit that just going to boost the results a little bit. Semaglutide's a clear one. Anything else, or is it would that be about the extent you go?
That's for the average American, like body composition, obesity is a pretty common issue. I think Sermorelin is great in terms of not only muscle recovery, but also body composition improvement. The one downside with Sermorelin, although it's effective in terms of those two things I mentioned, there is a little bit of an issue in terms of hypoglycemia associated with administration, meaning when people take it, you're producing insulin growth factor, your insulin sensitivity is increasing. Thus, people's blood sugar tends to decrease. And if you don't take it right before you go to bed, some people develop a hypoglycemic state, which is essentially low blood sugar. And unfortunately, people then run to their pantry and start to
super
eat
hungry
stuff that's not going to contribute to the result that we're looking for, which is usually a decrease in body fat. So I have had some patients that after a month, they're like, how am I gaining weight? And I'm like, well, are you taking it at the appropriate time? They're like, yeah, but like sometimes I get really hungry. And the next thing you know, I've had a whole, bag of chips. I'm like, well, then, Sermorelin may or may not be the best thing for you, especially if we can't get past that, or you can't control yourself to not eat when that happens. So, for the most part right now, I think the Morellin family is great. And then most people have aches, pains, they're constantly dealing with injuries that they've, even though they're not severe, little bumps and bruises that they've introduced through the weekend warrior syndrome that they have. So BPC 157 is one that I'm for the most part, I'm like, pretty much everyone should be doing this.
All right, cool. So let's leave those ones and go to more of, I want to talk more about kind of performance enhancement stuff. But before we get there, like maybe the injury one's pretty cool too. So let's say somebody is going to go in for a procedure, even if it's a small scope or something on their knee or whatever, or to a big one. You've talked about BPC 157. If you're not a professional athlete, you're still good to go there. And I know a lot of surgeons who are now just making that kind of common practice. They're just putting it directly in post-surgery or doing something differently. So can you talk a little bit more about BPC 157? Again, what's the kind of cost? What's the risk? What's the benefit? And then any other ones?
Yeah, relatively low risk, all things considered. Essentially, it's just helping, collagen repair and tissue repair, specifically of ligament and tendon. So the administration is typically in the morning. It's an insulin syringe. You don't even feel it. You're doing it Monday through Friday. Typically, I tell people, 2 to 3 months is the minimum time that you're going to want to do it.
So it doesn't magically fix you in 2 weeks? That's what the internet told me.
No. Like some people experience an impact pretty quickly, but it's usually 2 to 3 months is kind of the timeline where you want to use it and then reflect back and say, hey, how frequently am I feeling inflammation? How much pain am I feeling in the joints that initially I was, using this to treat? Is it completely resolved? Is it reduced, a certain percentage? So that's typically what I tell people is if you're going to do this, commit to 2 or 3 months of use, and then we can gauge efficacy. And the cost per month is, usually around $200 to $250 per month all in. So again,
which is not honestly bad if it saves you.
No, that's not bad compared to surgery, especially if you're doing it in place of like something non-invasive to test out first.
Yeah, I think that's one thing to consider. And then two, again, you have to look at the big picture, right? So there's a really good book for people listening called The Price We Pay by Marty McCary, which talks about everything that has to do with costs of medicine, both from the hospital side, also from the patient side. People do not understand how much money they're spending or losing in terms of doctor visits, PT, medications they're taking regularly, and what that accumulates over a long period of time. So if you have the opportunity to try something that can help effectively heal, these common musculoskeletal issues, tendinopathies, inflammation, things like that, gut health issues, whatever, and you're spending $700 over a few months, and then you get years and years of higher level performance with, minimal issue, that makes more sense to me than paying, $50 to $100 for anti-inflammatory meds or pain meds or whatever that looks like, or even over-the-counter stuff, in addition to accrued cost of doctor visits, physical therapy, insurance costs, and things like that. So
work loss, productivity loss, all that.
Work loss. Yeah. Like what's the opportunity cost of not being able to play a sport that you love being able to play, you love playing, into your 50s, 60s, and 70s. And that those things aren't necessarily quantifiable, but it's a quality of life issue. So I think there's two things you have to consider, like, what are you willing to give up to potentially completely heal? And what does that mean to you? What cost is associated with that? And I can't, force people to think the way that I think, but in my mind, investing and doing it the right way the first time will always save you money in the long term versus trying to find shortcuts and cutting corners. I guarantee you'll end up spending more money, more time, trying to piecemeal things that are less efficacious. So, that's kind of how I frame it for most people. And again, reminding them that if they're dealing with issues that have to do with, just degeneration of the body, like, if you're not sleeping, if you're not cutting down on alcohol intake, if your diet's still garbage, again, these things aren't going to be as effective as they could be. So you might as well give yourself 60 to 90 days to really dial it in. Because what's the worst that can happen other than you completely change your life and you have, decades of higher quality living. So
any need to take the BPC before the surgery?
So essentially what we're doing now, and I'm working with a group out of LA, and we're creating a program called Surgery as a Sport. And in brief, some of the work I did as a resident was regarding this pathway called ERAS, enhanced recovery after surgery. Because what we found is people are showing up for elective procedures and not understanding the physiologic and metabolic impact that a surgical procedure has on your body. In brief, right?
Yeah.
So being in a hospital, terrible for recovery, terrible for your HPA access stress. But even if you have to have an elective procedure, people need to understand the metabolic impact of tissue manipulation, surgery, healing. It's like running a marathon. And if I told you, hey, you're going to run a marathon this weekend, you'd be like, nope, like I haven't trained for it. I haven't done the right preparation. But if you did, on the back end, you'd probably in complete disarray. Your body's going to break down. You'll feel terrible. So people understand that. Surgery is basically the same thing. So if you know you have to have a procedure and you are not preparing as though it were a race or an athletic performance, your outcomes may not be as effective. They may take longer. So a lot of practitioners in the group we're working with is basically saying, okay, if you have to have an elective orthopedic procedure, we're not going to do it unless you come to me, get pre-op labs done, optimize nutrition, make sure you're getting enough protein, make sure you're monitoring inflammation, potentially starting peptides prior to a procedure so that you can, have that process already in place post-operatively so that your healing, both tissue and otherwise, is more effective and can be, shortened potentially so that you can have a better chance of a high-level outcome. Which is great for the patient and also the practitioner, because practitioners are graded based on patient outcomes. And if they're showing up in a bad state, it reflects poorly on the practitioner, even if their skill and their technique is top notch. They're at the behest of who are they operating on and what are they doing on a daily basis. So there's some interesting things that are happening in that space. And in terms of essentially treating surgery like you were going to run a marathon or a half marathon, but you have to think about it similarly. So in that case, Dr. Galpin, yes, I would say some people should think about starting prior to a procedure just to get that, healing process going.
But you would probably be talking like a few days or like weeks?
Yeah, I would start, a couple weeks before. Yeah, a couple weeks before. Because realistically, like if someone tears their ACL, they're not going to want to wait 6 months to get an optimization program really dialed in. We have to be reasonable with what patients are willing to do. So, usually we start 4 to 6 weeks in advance and just say, hey, like you want a great outcome from this procedure. I don't think anyone goes in and says, yeah, I don't want the best possible outcome. Well, if you want to do that, you need to dial in movement, sleep, hormones, supplementation, diet. So, it's a pretty cool experiment that we're running, and hopefully it's something that we can then expand to other practitioners across.
That's really interesting. I know a lot of folks who are actually look at that same space and be like, man, why do we not have pre-surgery?
Totally.
Like it totally makes sense. Like walking
So for instance, right, I'll just give you a brief example. So if you were to have a surgery, right, the typical protocol says don't eat, 12, 16, 24 hours before a procedure. Then you have your procedure. It lasts a couple hours. Post-operatively, you don't really feel like eating. You're coming off of anesthesia. So realistically, we've introduced a significant metabolic insult to your body. And you've also been in like a fasted state for like 24 hours, right? And then you might be nauseous. You may not be eating a lot. You may be on pain meds. Your bowels aren't moving. So a lot of people get like terrible nutrition for a couple days, after a procedure. Why would you expect that your body's all of a sudden going to be like, yeah, we're going to function at peak performance, but you haven't been sleeping. You've been in pain. You haven't really felt like eating. You showed up in a fasted
because
state.
Fasting is anabolic. Duh.
Yeah, sure. So, oops. Yeah, but like a lot of these things that we're doing on the medical side are somewhat archaic and were introduced, 100 years ago. And everyone's like, well, that's what we've been doing. So why would we think about it differently? And we're seeing in Europe and other places, especially from the surgical side, they're like, is it actually good that these people haven't eaten in 18 hours before surgery? Is it good that we're giving them pain meds and not encouraging, efficacious bowel function and reawakening of the gut tissue after these surgeries? So in Europe, they're a little bit more advanced than we are in the US, but we're trying to usher in a new thought process in terms of what happens for people that do need procedures. How can peptides play a role? How can other lifestyle optimization practices take a role or play a role? So we're moving in the right direction, but it'll just take some time.
And hospital food is just so nutritious, right?
My God. I think I saw a stat that like 40% of all hospitals have fast food locations like on site. And that's basically what people are able to order. So
I didn't intend to go this route, but since we're here, I feel like the people listening would be like, what the hell? Do you have any best practices then that you're willing to share of like, what should they eat? Should they try to have as much protein as possible? Are there types? Should they try to get collagen in? Vitamin C, I think like anything like that?
Vitamin C, vitamin D are super important. Caloric intake is important. You essentially have to appreciate that your metabolic rate's going to increase like 1.5 to 2 times its normal level after a procedure, because the body's going to try to heal tissue. So if you're not changing your caloric intake, protein and collagen obviously are super helpful for tissue recovery. Those are the 2 areas where I try to work with people the most, which is like understanding, okay, how much do you eat normally? What's that quantity? And how much do we need to increase it to match what your body's going to be asking for post-operatively? From the supplement side, vitamin C, glutathione, turmeric, or curcumin, whatever you want to use. Vitamin D is very important for inflammation and tissue healing. Dr. Galpin's been beating on that one for a while now in terms of vitamin D's role in inflammation. So those are the areas that I typically work in optimizing for people. And then creatine. So creatine is another one that's been recently pretty well elucidated in terms of its impact on muscle protein synthesis, muscle maintenance, even in elderly populations that aren't moving a ton. Creatine looks like it's pretty effective for almost everybody. So I try not to bury people in like supplementation and things that they have to do, but I think those are pretty simple to administer and introduce.
What about like a greens drink or anything like that? Like kind of used like,
no,
okay, I'm sure.
I try to get people, in all honesty, to work on reestablishing healthy gut function, because anytime you're under anesthetic, taking pain meds, which is inevitable for the most part, your gut function is going to decrease. And, your gut is essentially, one, the space for digestion and absorption. So if things aren't moving, you're not digesting well. And 2, it's also excretion, right? So you want to get out the waste products that you don't need, and you don't want them sitting in there ruminating and stewing for the potential re-exposure of these things that you don't need. So green juices, like, okay, in terms of, I understand like the delivery of, vitamins and nutrients, but realistically, we want to get people trying to reawaken gut activity as fast as possible. And the way you're going to do that is reintroducing foods that, are in their more natural state, higher in fiber, as long as they can tolerate it.
Lovely.
Yeah.
So then maybe if you're okay, we can venture down into like peak performance stuff.
Sure.
Yeah. So yeah, anything you want to add, or anything that you can contribute there?
Yeah. So I think there's a couple peptides that are pretty interesting in terms of like the peak performance space. Like obviously the ones we've talked about, CJC, BPC are helpful. There's a couple that are coming into a little bit more awareness and understanding amongst practitioners and then hopefully patients that have to do with like cognitive function, immune function, neuroregeneration, things similar to anti-aging recovery, like apidolon. I don't know, Dr. Galpin, if you've ever heard of apidolon, but it's basically like a pineal peptide that helps improve resilience. It's an antioxidant. It's been shown in some studies to help maintain telomere length. If you believe in terms of aging is actually just the degradation of your DNA. It helps with immune system function, prolactin levels, pancreatic function, so insulin sensitivity, blood sugar control. And some studies show that it may help with melatonin production, natural melatonin production, because it's coming from the pineal gland. So to help promote healthier, more efficacious sleep, especially as people get older, because we know the pineal gland decreases function as you age. And as part of that, people, when they get older, they tend to sleep less. That's one of the things that accelerates aging. So apidolon is a pretty interesting one. It's not inexpensive. It's like $300-ish per month. So it's definitely one of the higher priced peptides. And then the other one is CMAX, SEMAX, which it's an adrenocorticotropic hormone. So basically, it's kind of like supporting your HPA axis, hypothalamic pituitary adrenal axis. So it's helping manage stress. It's helping immune function. A lot of people in the peptide space are using CMAX as a nasally administered spray, because there is a correlation with these types of hormones in terms of neuronal protection, pain control, in terms of people that are dealing with chronic pain, because again, pain is literally just a signal that's being interpreted by the brain. And if we have the ability to modulate, the severity of these pain responses, sometimes that can be helpful. So those are pretty interesting ones. Apidolon's an injection. CMAX can be an injection. It can also be administered nasally because it gets into the venous plexus in the nose, which then circulates through your cerebral circulation. So those are pretty interesting ones in terms of like quote unquote peak performance. And there's another peptide, and I just want to make sure that I have this right here. So I'm going to pull it up, but it's called muscle growth factor, which, as kind of the name would indicate, muscle growth factor helps with muscle recovery. So it's a variant of IGF-1, and it's very specific for facilitating repair and hypertrophy of specifically musculoskeletal tissue. So it's already expressed in myocytes in terms of repair of muscle cells, facilitating growth of new cells. So it's very similar to an IGF-1 response. But it does, its half-life is very short, and it does oxidize pretty quickly. So that's one of those things where if you're getting MGF from a peptide provider, like you want to make sure it's fresh, that it hasn't been stored for months on a shelf, because if you're getting it, after months after its creation or its synthesization, I don't know what is that word? Synthesizing.
Synthesization.
Synthesization. Yeah, it may or may not be
synthesization.
Yeah, I don't know if that's a word. We may have just made one up there. So
that's all right.
So those are a couple: MGF, CMAX, apidolon, and then there's also like GHRP6 and GHRP2, which those stand for growth hormone releasing peptide number 6, and GHRP2. They're growth hormone analogs. They cause your body to produce more growth hormone. They're usually paired with a CJC or an ipamorelin or a sermorelin. But especially for people who have issues with tissue healing, ligament healing, for some people, like scar formation can be improved, especially if you're taking these GHRP6 and GHRP2. Those are all things to think about. So those are a couple for peak performance that I think are reasonable, especially for people that are looking for more longevity. You may want to think about, an Epidolon or a C-Max, something like that.
What's the status, going back to that muscle one? I've not heard of that one.
MGF, yeah.
Yeah. Any human trials? Lots of animal stuff? Like,
not a ton. It's more animal stuff. The tough part with MGF is it breaks down very, very quickly. So realistically, like, people are making it and using it right away. So what's the applicability from the human standpoint? Like, if you're getting it and it's, for instance, like, a lot of peptide manufacturers will make something and they'll freeze it and then they'll thaw it and send it to you, and you need to use it pretty quickly. If the practice controls are not as efficacious as they should be in terms of quality control, you may be getting something that is essentially inert and it's not really going to impact. Sometimes I use peptides from this group in South Carolina. Craig Conover is a physician that's been using peptides for a long period of time. He worked with Onnit and Aubrey Marcus in that group. And they work with a group actually called Peptide Sciences, who makes all their peptides, and they're pretty good about making, freezing, thawing, sending, and using right away. So that's where I get most of my MGF. But it's definitely on the newer side of the peptide scope.
You've had good experience with it so far. What would you say is
Yes.
like the most benefit for it? And what's the biggest thing you're seeing out of it?
Recovery and performance, right? So the reason it's illegal in pro sports is if you're using it consistently, you can basically get up day after day and hit 2 days and not be as debilitated or sore as you would if you were not using something like this. So in terms of training volume, it can definitely increase your capacity for training volume. Is that necessarily a good thing? Like, is it too much? Dr. Galpin came up and spoke to my team and was like, there is a point of diminishing returns in terms of how much you're training, how you're training. So for some people, they assume, like, if they're doing it and they feel great, they can work out 3, 4, 5 hours a day. Like, is that actually good for you? Maybe, maybe not. But I think for people that typically, aren't as consistent and they hit, hard workouts and then they have a couple days of decreased activity because they're sore, this allows for the opportunity to continue in terms of training intensity and volume a little bit more regular, which will then lead to, muscle growth, greater strength, better performance.
Any potential concerns for that one that obviously
not really. Yeah, no, not really. Again, like, it's a compound your body's naturally producing at the musculoskeletal level to help with tissue healing and growth of new muscle neurons. So, like, again, I think over time, as we gather more data, I don't suspect that it will contribute to tumor growth. But it's something that if you're going to do peptides, you want to monitor with a physician by checking your blood work regularly. And if something doesn't feel right, obviously being able to consult with somebody to try and troubleshoot. I have seen patients not on my watch have developed, malignant neoplasm secondary to long-term use of growth hormone that just wasn't monitored well. And it's unfortunate because then you have to go down the road of treatment for that, which is not easy.
Yeah, but we sort of known that with growth hormone for a while, though. Like,
we have.
Like, we know that one's coming.
Yeah, for sure. And it's one of those things where you don't think about it until it happens, and you're like, "Shit, I probably shouldn't have been doing this." But but if people can get it and they have the money, they're going to do it. So you need a voice of reason, which is where a physician who can guide you on utilization is helpful.
Who actually pays attention to you over time.
Yeah, we try.
Yeah.
I try.
Is that one specific to skeletal muscle, not cardiac or other types of muscle? So it's skeletal muscle only, correct?
That's correct. Yes.
Nice.
And that doesn't need to be local injection, I assume.
Nope, systemic. So you can just put it in belly fat. Yeah. I mean, that's the other thing too, right? And like, that's it's the same conversation I have to have with people that are looking to do PRP, stem cell, stuff like that. Is like, if I'm going to do PRP on a patient and I know it's going intra-articular, meaning in a joint, I have reasonable belief it's going to stay there. It's not going to seep out and then go somewhere else.
Totally.
But with stem cells these days, man, like there's clinics everywhere. It's like, if you do an IV of stem cells, like we guarantee it's going to help with your back pain or your muscle recovery. Like, you have no idea where the cells are going to go. Once they're in your system, they're going to go wherever they get called. So that's where peptides can be a little bit more beneficial versus like a growth hormone, meaning like growth hormone, synthetic, commercial grade is going to make anything that needs to heal. That could be skeletal muscle, that could be heart, it could be tumor, could be bone. But peptides tend to have more specific localization to certain tissue types, whether that's gut, brain, skeletal muscle. So I think the safety profile is a little bit better. But again, if you're doing these things for 10, 15 years at a time, like we just don't have the data to understand like what are the potential ramifications.
Well, for that one in particular, we don't, but we generally know like it's probably not going to be a good idea.
Probably not. So I try to get people on for 3 to 6 months and then have them taper off for a while. So
yeah. What I asked you this kind of on Barbell Shrugged, but I always think it's kind of interesting for the other ones. Are there any ones that other people are really, really excited about, they use a lot, that you just like, I just don't think this one's very good? I don't, you talked on the Barbell Shrugged about some that you discontinued and why, but is there any ones jump out as ones that are popular, but you just haven't seen work well for your patients?
To be honest, not really. Most people that are coming to me who have any knowledge of peptides whatsoever are usually talking about the common ones that I kind of spoke of before. The only variation I've experienced is kind of the localization of use of certain things, such as localized BPC. One thing I guess that I would say is I have a fair number of people that have found BPC oral tablets that they can get for $60 or $90 mail order. We know almost unequivocally anything that's BPC that's going in your mouth is not going to get into your systemic circulation. It's going to stick with your gut because that's where it was originally identified and acknowledged as its place of initial physiologic use. So like when people do that, they're like, I'm on a BPC oral supplement. I'm like, yeah, it's probably not doing anything for you from a tissue healing standpoint. So if you're going to do BPC, you should do it systemically administered. But other than that,
for the sake of tissue healing, unless you're trying to heal gut.
Yeah.
Right.
Unless you're trying to heal gut. But yeah, for the most part, peptides are like so relatively new in the space. The only thing that people really talk about are like the sermorelins, ipamorelins, BPC, thymosin occasionally. Most people don't even know what's available. And that's where, I have the opportunity to educate them on some other things that may be helpful for them. But for the most part, it's like such a novel space that there's really not a lot people are just seeking out and ordering from, a Russian lab. And they're like, I got, clenbuterol from Russia.
Right.
But that's not a peptide either.
Yeah, because there's, like you said at the beginning, peptides are not new. It's just sort of these kind of applications are new, but insulin, we could give you 100 examples of things that people have heard of. You're like, oh shit, I didn't realize that was a peptide.
Yeah.
Right.
Yeah.
They've been around for a truckload of years.
Yes.
So these are not like, I think it's one of the reasons why the safety profile is generally pretty good in these actually.
Yeah.
Because they've been around for a long ass time. It's just like kind of creating new ones and trying to make it more relevant. Any other use of peptides besides, we talked about fat loss, like we talked about muscle recovery and regeneration. Was there any, like you talked a little bit about kind of quickly about maybe some sleep aid stuff and
inflammation, cognitive function, sleep. That's where like the Cmax may be helpful. We mentioned sleep. The longevity one, like the Apidolon, is an interesting one, and in like the sense of like potentially reducing DNA degradation, antioxidant impact. There are a couple zinc-related peptides and copper-related peptides. Again, I mentioned one called GHK-CU, which is CU is the periodic table for copper, that has some potential benefit for inflammation, muscle pain, nerve pain, potentially muscle recovery. There's a couple zinc peptides that have been hypothesized when they're usually there. It's like a cream for the scalp, can help with potential hair growth for hair loss. I haven't seen a lot of efficacy in people that have used that, so I don't really toss that out first, but it's out there. So some people are using it. But for the most part, I try to keep my peptide protocols relatively tight with the things that I know are effective. And again, only try to introduce them when I know that someone is also doing the other components that's going to optimize, basic health and wellness.
The vast majority of these are going to be injections, right? Like you
Correct.
just mentioned, one is a cream, but unless the oral BPC, right? But that's pretty much injections.
For the most part, Conover has a couple transdermal patches where you can get a couple of their peptide formulations administered transdermally for people that are completely adverse to injections. But you're looking like $100 a patch, and you need to use a patch a day again for a month. So like I tell people, like, let me teach you how to do this injection. I guarantee after one, you'll be okay with it. And then it'll also save you a significant amount of money. So there are a couple other options. There's some sublingual sprays that may be helpful. I'm just not a huge proponent of things that have to be orally administered because you have no idea how it's going to be processed, digested, or absorbed. So if you're going to do something, if you're going to spend the money on something, in my opinion, it needs to be subcutaneous, intramuscular, or intravenous if you really want to gain maximum impact.
And most of them, the injection is just a small insulin needle, right? Yep. So for weirdos like me that hate needles, it's not a big needle.
Yeah, you don't even feel it. It's 3/16 of an inch. You don't even feel it.
It's what, like 30 gauge or something, or smaller?
31 gauge. It's very, very small. Very small. Yeah.
Tiny amount. You have to be a little bit of a chemist yourself, kind of. You got to fill it yourself and inject it. It's really not.
Yeah. I mean, I think people think it's cool. Like they think they're doing something cool. They're drawing syringes, injecting themselves. So yeah, it's pretty cool.
Dope. Anything else that like you thought about or think is interesting in the peptide world?
I think it's just one of those things where these are absolutely supplements that are effective in the right individual who's doing the right thing. So it is not a cure-all. It's not a panacea for your bad behavior. So if you are not participating or at least trying to improve other aspects of health that have contributed to the conditions that you're trying to treat, it's not going to change a lot, right? So if you don't change your diet, you don't change your sleep habits, movement, hydration, all those different things, like these are not going to cure all of your ills. If they were, we would have known about them a long time ago. So I think they are most effective in people that are also engaging in improving lifestyle behaviors. And if you can do both things, you will see a significant positive result. And if you don't, you may get a little improvement.
Actually, my sort of last question here that I wanted to ask last time, I forgot. Most of these things have a direct effect on a cause. So you take BPC, the tissue is going to heal. Great. Right. Like they're not actually solving, they're not enhancing physiological ability, right? They're just kind of directly causing a solution to a problem. So are you aware of any of that outside of growth hormone, of course, that are actually going to enhance physiological state, like it would if you had a micronutrient, like if your copper was super low or zinc was super low, and you improve that status, you would see this like well-rounded improvement in hormone profile and sleep and recovery and growth. Like, are they fixing anything, or are they just kind of like just filling that hole that's there?
I think they're supporting. I think they're supporting physiologic function in the. How do I want to say this? They're supporting physiologic function within the scope of other lifestyle improvements. So I think it's not a long-term solution. So for people that may have inflammation, tissue healing issues, potentially cognitive dysfunction, like people with concussion, traumatic brain injury, CMAX, things like that can help support with neuroinflammation and regeneration. But again, like none of these things are are meant for long-term use. So I think if you're not removing the variables that are contributing to your detriment, then you're going to, probably have to use these things for a longer period of time. But yeah, so it's nothing like, a vitamin D deficiency or something like that, where it's going to hopefully correct and then your body, maintains some sort of, ineffective hormone production. Or like an iron deficiency where you have low hemoglobin, then you take iron and all of a sudden your body produces more hemoglobin, then you're good. Like, it's nothing like that. So they are absolutely an adjunct component that can help facilitate more efficacious recovery or whatever result you want, but it's nothing that's going to change physiology.
Okay, my true last question. I forgot about this one.
Great.
Any contraindications, not necessarily like with disease patients, there's always that, but just in terms of like, if you start taking these peptides, you don't want to also take creatine, or you don't want to also take magnesium, or like any other stuff is like, you got to take care of.
Nope. There's nothing that's been so significantly notable that it's, basically become applicable across the board. So for the most part, these things, kind of do what they're meant to do, and you can introduce them in addition to other things that you're trying to improve. But yeah, there's no significant contraindication. It's not like taking antibiotics and not drinking alcohol because you're going to decrease the efficacy of the antibiotic. It's nothing like that. No.
Yeah. Cool. That's awesome. My only last question is not necessarily a peptide, but more of a curiosity.
Sure.
Do you use like as a supplement NR or NMN? And if you do, orally or by IV? Because I know if I don't ask, there's going to be tons of people who are going to email me like, "Why didn't you ask him? It's not a peptide." But
so I personally use True Niagen, which is nicotinamide riboside. Has it helped me? I don't know, to be honest. I kind of just take it because I get it sent to me and it's not harming me.
Yeah.
So
I'll be
completely honest. I have seen patients where we've administered NAD intravenously, notice improvements in inflammation.
NAD direct.
But again, that's not a comfortable process, and it's also very costly. So I am not a huge proponent of anything that's administered orally. I just don't think we have the understanding in terms of, is it really being converted? Is it being digested, absorbed, processed appropriately once it gets through the liver? Mm-hmm. I think in animal studies, there's reason to believe that it might. But again, like, you're looking at a population that's in an animal model that's pretty controlled and it's pretty regulated. Humans are a completely different beast, pun intended. So yeah, I'm not a huge fan of those things. I have noticed some people appreciate some benefit from like transdermal NAD patches because it's a little less uncomfortable than an NAD IV. But again, cost is a factor there. So I'm not a huge NAD guy unless you're doing it intravenously.
And intravenously, would you be looking more for potentially after TMI or TBI or just
TBI,
general?
People with chronic inflammation, chronic pain, issues associated with addiction, things like that. So that's where I've seen it more beneficial. But again, it's not comfortable and it's also quite costly. So,
and what is about an average cost for like one session? I mean, I have a
$500
rough idea what it is for people listening. So
again, like $500 to $700 usually per treatment.
Yeah, that's what $350 was the cheapest to $750. That was per session, so to speak.
Yeah, that's about right.
Cool. So awesome. Well, thank you guys so much for all your time. I really appreciate it. Thank you, Andy, for all the great questions. So we'll start with Ryan first. Where can people find out more about you? Because you said you do this as telemedicine now too. So people don't necessarily have to be in California to work with you, correct?
Sure. Yeah. So the easiest way to find me is Instagram, Dr._Greene with an E at the end, _DO, Dr._Greene _DO. Our facility website's monarchweho, WEHO.com. So those are the two best ways to reach me. And from there, I'm pretty responsive, and we can set up consultations and things like that.
Awesome. Dr. Andy Galpin, if people want to find you, or maybe just want to stay hidden and they should just follow your educational stuff.
No, it's from facing there. Like I do want to plug
Yes, plug away
for himself. Actually, he mentioned this, but the approach that Monarch is taking, I think, is fantastic. I think that represents the best blend of scientific best practices while also trying to push the forefront. Right? It's not just work out and eat. Like, we know that's true. It's also not just here's your $1,000 IV that's going to reverse your telomere length, right? So it's a great model. Having been in their facility a lot of times, it is like they push the training hard, like they push the lifestyle stuff, the checkpoints very, very hard. And it's not just lip service in terms of him saying like, yeah, you got to do this stuff in conjunction with lifestyle. That's a core of their practice. And this stuff just gets the attention and gets a lot of people in the door, but that is really what they're going after. So if you are in, you guys are in, of course.
We're in West Hollywood, and then we have Brentwood opening in the summer. So we'll get east side of LA and west side of LA, and then beyond.
And then your telehealth stuff there that they can jab you in. But I'd say don't reach out to Ryan if you're just going to reach out to him and ask him if you can order BPC, whatever. Right? That's not the model he uses. Nope. Like if you really want to make a change, great. He can lead you through that, but he's just not your guy who's going to sell everyone who wants a GH.
No, not so for me.
Yeah. He's got a very large insurance policy behind him, but still.
Yeah. I practice what I preach. Long story short, if you're not going to do the simple things, like I'm not going to waste your time, money. Doesn't look good on me. Doesn't look good on you. So I'm not going to waste anyone's time.
Yep. I didn't want anyone kind of walking behind the scenes being like, oh, okay, I think what they're saying is this guy will order.
No.
If I just call him in?
No, that's awesome.
I
appreciate that.
Really clear to your audience that's not what you do.
That's perfect.
I appreciate it.
You can find me everywhere. Instagram, Twitter, all that stuff. The website, andygalpin.com. It's the best places.
Cool. Awesome. Well, thank you guys both again for all your time today. I really appreciate it. And I would encourage everyone to check out both of you for all the great stuff that you put out. Thanks again. Really appreciate it.
Thanks, guys. Appreciate it.
And thank you so much for listening to this podcast. As always, really, really appreciate it. If you want to help us out, as you've noticed so far to date, I don't take any other sponsors or outside ads. I've had a few requests now, and so far I've turned them all down. I'm not saying that I'll never do this, but right now the only sponsors I have are programs that I've created myself or for things that I do. So not against any other sponsorship, but if I ever did one, it would have to be a really good fit. So if you want to help us out in the meantime, you can get on the newsletter list via physiologicflexibility.com. All the information about the course there. The main website with everything is miketnelson.com. If you liked this episode, give us a review. Even a short few sentences makes a huge difference with the old iTunes and podcast algorithms. Subscribe to it and send it to someone who's looking for information about peptides. So one of the things I want to do with this podcast is have sort of a constant free reference. So if you have a buddy or a friend who is like, hey, what are these weird peptide things? And you can send them this episode. And if they want to go down that route or discuss the pros and cons, I'd highly recommend that they contact an expert like Dr. Ryan Greene. And the goal is to have high quality references that are free for you. So any comments, place them below in your favorite iTunes or podcast player. Thank you so much for listening. Really, really appreciate it. Any feedback for the show, let me know. We will talk to you all next week. Big, huge thank you to Dr. Ryan Greene for taking time out of his day. Be sure to check out his information there. And like I said, if you are looking at using peptides, I would highly recommend you get in touch with him or at least another physician who is up to date in that space. And they are out there, but they're really hard to find. For great educational material, check out Dr. Andy Galpin. He's got wonderful stuff, also for free on his YouTube, Instagram, everywhere else. Thank you so much. I will talk to you next week.
I don't think this show is suitable for children.
I don't think this show is suitable for anybody.